flexibility is so important when doing cataract surgery. This is a good case where I felt that it would be a very routine case, but I had to make a little bit of a change in the middle of the case because of the density of the lens. And so you'll see that there are some toric marks that I made for the patient because I was planning to do a toric lens. And the case overall seems to be going pretty routinely. It seemed like the lens wasn't very dense. In clinic, I graded it at about a 2 plus nuclear sclerosis. And you can see that there's a very good red reflex. And as my previous videos show, for routine cases, I like to use a pre-chopper device in order to split the lens into fragments so that I can reduce CDE and fluid flow in the eye. And so that was my plan for this case. And of course, doing a good hydrodissection is really important. Now, you'll see that I attempt to split the piece, and it's just not splitting. And it's really important not to push it with a pre-chopper. If you push it too hard, you may induce some zonulopathy, and so this is where flexibility is really important. I decided, because I wasn't able to use my pre-chopper, that I was going to try to chop the lens, and you can see it's quite a dense lens, and so I'm really trying to dig into the lens and break it down. And I like to do a combined vertical and horizontal chop, especially for these dense lenses, because it gives me good visibility, and I feel like I'm able to get a good purchase of the lens to really split it into pieces. And so I feel that at some point I've gotten enough pieces, and so I switch over to quad removal, and I'm able to take down the pieces pretty well. And you'll see that the CDE for this case actually ended up not being very high. And so for me, I think when I have these dense lenses, I try to chop the lens into as many small pieces as I can so that I'm not using a ton of phaco energy to break up a huge piece. And so I tried to break it into about maybe 6 or 8 fragments to efficiently and with less phaco energy remove the lens. And so now, the rest of the case goes very routinely. So I'm able to successfully remove all the cortical material. And in this case, this patient was actually very myopic. And so the lens of choice here was a toric lens of about 10 diopters. And the other sort of important thing that you'll see in a moment here is, and this is my aggressive polishing. The thing that I want to point out is that doing a good cleanup after the lens is in the bag is very important, not just for preventing a pressure spike on post-op day 1 and to reduce corneal edema, but you'll see another reason here in just a moment. And this was a Clarion lens that I placed, and it was a toric lens that I placed at the axis that was sort of predetermined. And for toric lens, I like to do a particularly good cleanup behind the lens. But so there's a lens fragment. And so that's why it's so important to do a really thorough cleanup of viscoelastic in the bag, and then also to do it in the anterior chamber. So a lot of times some of these pieces can hide in the sulcus, and that was a hard nuclear chip. And so, if that remained in the eye, then it may actually have created a lot of inflammation for the patient, and I probably would have had to go back in to remove that fragment. So doing a really good cleanup after the lens has been placed is really crucial to giving patients the best possible outcome. Um, the other thing is, obviously making sure that at the end of the case, after the cleanup and after the hydration of the wounds, that the lens is in a good position, especially, lining it up to the correct axis, not just making sure it's in the bag, but making sure it's in the correct axis. And then, of course, just checking the wounds at the end to make sure there's no leaks. And so overall, this patient did really well. Post-op day one, they were 20/20, and they were really, really happy with their vision, and really excited to have their next eye done.